Hi, Dr. Pelto here. I'm going to answer a question that a patient had the other day on the questions underneath the video. And if you have your own question, please place it under this video. I have a small avulsion fracture at the plantar base. Do you know how often these heal on their own? Let's talk a little bit about what an avulsion fracture is. An avulsion fracture, you can see right here, avulsion fracture. The most common area that I see an avulsion fracture is the fifth metatarsal at the base, this little purple area. And this is where a tendon inserts called the peroneus brevis. It's just one of the tendons that runs on the side of your foot. And when the tendon pulls hard, usually because you're twisting your foot or spraining your foot, it pulls harder than the strength of the bone. A portion of the bone pops off. Okay, that's not something called an os peroneum, which is an extra bone. Extra bone is different than an avulsion fracture. Avulsion fractures can happen a lot of different places, but usually it's an area where a tendon inserts into a bone. For example, here's an example where there is a little piece of bone right here, and the tendon pulls off this bone. It can very commonly be mistaken for a fracture fragment as well from bones jamming against each other. This is an example, and here's one on the big toe on the bottom. So this is a side view, a little bit kind of a side view, and there's a pull or an example right here where there's a pull off at the base of the big toe joint. And if it's a very small fracture, we usually put patients either in a walking boot or a can boot for a period of time, and we don't normally surgically fix this. Why? Well, there's no way to fix it if it's too small. If you try to put a pin in there, many times you are going to bust that little fragment. You can try to immobilize it. That's where patients, especially if it's a hand, they'll put them in a splint. And then if it doesn't heal, you can remove that little piece, that little fragment that's in there, and reattach the tendon to the bone. And these many times do heal on their own, but if they don't, you should see a professional. I have a couple of other videos that talk about treating fractures, and I'm going to include that as well, some other helpful information. Once again, I hope you had found this beneficial. If you have any questions, please put them underneath this video.